Mestinon is a prescription medication used to treat neuromuscular disorders. These are conditions that affect the communication between nerves and muscles. This can lead to muscle weakness and fatigue. Mestinon helps improve this communication, making it easier for muscles to contract. Mestinon is most commonly used to treat a condition called myasthenia gravis. In myasthenia gravis, the body's immune system mistakenly attacks the connections between nerves and muscles. This disrupts the signals that tell muscles to move. Mestinon helps to strengthen these signals, improving muscle strength and reducing fatigue. Beyond myasthenia gravis, Mestinon is also used to treat other conditions. These include congenital myasthenic syndrome and Lambert-Eaton myasthenic syndrome. Both of these conditions also involve problems with nerve-muscle communication. Mestinon can help manage symptoms and improve quality of life for individuals with these disorders. To understand how Mestinon works, we need to understand how nerves communicate with muscles. This communication happens at a specialized junction called the neuromuscular junction. When a nerve impulse reaches this junction, it releases a neurotransmitter called acetylcholine. Acetylcholine acts as a messenger. It binds to receptors on muscle cells, triggering them to contract. In conditions like myasthenia gravis, this process is disrupted. The immune system attacks the receptors for acetylcholine, making it difficult for muscles to receive the signal to contract. This is where Mestinon comes in. Mestinon belongs to a class of drugs called cholinesterase inhibitors. Cholinesterase is an enzyme that breaks down acetylcholine. By inhibiting this enzyme, Mestinon allows acetylcholine to remain at the neuromuscular junction for a longer period. This increased concentration of acetylcholine means that even with fewer receptors available, muscles are more likely to receive the signal to contract. This leads to improved muscle strength and reduced fatigue in individuals with myasthenia gravis and other neuromuscular disorders. Myasthenia gravis is the most common condition treated with Mestinon. This chronic autoimmune disease affects the neuromuscular junction, leading to muscle weakness and fatigue. The weakness typically worsens with activity and improves with rest. The hallmark symptoms of myasthenia gravis are drooping eyelids, double vision, difficulty swallowing, and weakness in the arms and legs. Mestinon helps to alleviate these symptoms by increasing the availability of acetylcholine at the neuromuscular junction. Apart from myasthenia gravis, Mestinon is also used to manage symptoms of congenital myasthenic syndrome. This is a group of inherited disorders that affect the neuromuscular junction, leading to muscle weakness and fatigue from birth or early childhood. Another condition that benefits from Mestinon is Lambert-Eaton myasthenic syndrome. This rare autoimmune disorder affects the nerve endings, reducing the release of acetylcholine. Mestinon helps to compensate for this reduced acetylcholine release, improving muscle strength and reducing fatigue. Mestinon is available in two main forms, tablets and syrup. The tablet form is the most common and comes in different strengths. The syrup is typically used for children or individuals who have difficulty swallowing tablets. There is an extended release Mestinon. Ask your healthcare provider more about it. Dosage varies depending on the individual and their condition. Take Mestinon exactly as prescribed by a healthcare provider. Timing is crucial when taking Mestinon. It is usually taken multiple times a day to maintain a consistent level. Mestinon helps manage symptoms and improve quality of life. For individuals with neuromuscular disorders like myasthenia gravis, Mestinon can significantly improve quality of life. By enhancing nerve-muscle communication, Mestinon helps to restore muscle strength and reduce fatigue. This can make a world of difference in their ability to perform daily activities. Mestinon can help them regain their independence and participate more fully in life. Beyond physical activities, Mestinon can also improve social and emotional well-being. While Mestinon is generally safe and effective, it can cause side effects in some individuals. Most side effects are mild and tend to improve as the body adjusts to the medication. However, it's important to be aware of potential side effects and seek medical attention if they occur. Common side effects of Mestinon include nausea, vomiting, diarrhea, abdominal cramps, increased salivation, and sweating. These side effects are often temporary and can be minimized by taking the medication with food or milk. These side effects are rare but require immediate medical attention. It's important to communicate openly with a healthcare provider about any side effects experienced while taking Mestinon. They can help to manage these side effects by adjusting the dosage or prescribing medications to alleviate specific symptoms. Mestinon is typically considered for individuals who have been diagnosed with a neuromuscular disorder, such as myasthenia gravis, congenital myasthenic syndrome, or Lambert-Eaton myasthenic syndrome. The decision to prescribe Mestinon is based on a variety of factors, including the severity of symptoms, overall health, and other medications being taken. A thorough medical evaluation is essential to determine if Mestinon is appropriate. This may involve a physical exam, review of medical history, and specialized tests to assess muscle strength and nerve function. Individuals with certain medical conditions may need to take precautions or avoid Mestinon altogether. These include a history of stomach ulcers, bowel obstruction, urinary tract obstruction, asthma, slow heart rate, or overactive thyroid. It's crucial to discuss all medical conditions and medications with a healthcare provider before starting Mestinon. This will help to minimize the risk of potential interactions or complications. Open communication and shared decision-making are essential for ensuring safe and effective treatment. Mestinon is often used in conjunction with other treatments to manage neuromuscular disorders. The specific combination of treatments varies depending on the individual and their condition. In addition to Mestinon, treatment for myasthenia gravis may include corticosteroids, immunosuppressants, intravenous immunoglobulin, IVIG, plasmapheresis, and thymectomy, which is the surgical removal of the thymus gland. Corticosteroids and immunosuppressants help to suppress the immune system, reducing the attack on the neuromuscular junction. IVIG provides the body with healthy antibodies, while plasmapheresis removes harmful antibodies from the bloodstream. Thymectomy can be beneficial for individuals with tumors in the thymus gland. The goal of combination therapy is to provide comprehensive management of neuromuscular disorders, addressing both the underlying cause and the symptoms. Regular monitoring by a healthcare provider is essential to assess the effectiveness of treatment and make any necessary adjustments. Mestinon plays a vital role in managing neuromuscular disorders, particularly myasthenia gravis. By enhancing nerve-muscle communication, Mestinon helps to restore muscle strength, reduce fatigue, and improve overall quality of life for individuals living with these challenging conditions. While Mestinon is generally safe and effective, it's important to be aware of potential side effects and communicate openly with a healthcare provider about any concerns. Combining Mestinon with other treatment approaches can provide comprehensive management and improve long-term outcomes. If you or a loved one is struggling with muscle weakness or fatigue, it's essential to seek medical attention. Early diagnosis and treatment are crucial for managing neuromuscular disorders and improving quality of life.